Good evening. Live. Thank you for joining us today. Sorry we are a few minutes late. Dr. Simonian and Dr. Rubin. So I want to do a disclaimer. This beautiful Dr. Rubin here is my daughter-in-law. Navigate Home is a group of professionals that come together for you tips on really different things concerning everything seniors. And there's been several articles out just recently about the reason for people falling. So I thought, oh my goodness, this would be a great opportunity to have, I love it, out of Madison Heights. And so Dr. Simonian, why don't you introduce yourself a little bit and tell us about your
practice for almost 40 years in Madison Heights. I started as a solo practitioner and pretty much practiced about 5.5 years ago. And it's been a true blessing and a joy to be able to work with my daughter and Joy and Kin Sharon.
I love that because I know that you
both.
So Dr. Rubin, tell us a little bit just about yourself and then we'll get started.
Yeah, mom's practice in 2015. It's been absolutely fantastic working with her. And now I get to see her every day at work. It's been fantastic.
That is, I mean, this is such really, truly well doctors, and we really entrust our parents. So my mom is in her 80s, so we're really just here to try to educate you about the different things that they might encounter. And I know several times, Dr. Acuity. What does that really mean?
Visual acuity is a notation we make of, in other words, when you're looking at a target, how well can you see it? And that number is compared. So you often hear two numbers, 20/20, 20/30, 20/40. The first number stands for the target or the eye chart being 20 feet away. The size of the letters. The bigger the letter, the higher the number. So we all strive for investigation as to what the cause is.
That makes perfect sense. Thank you. Because you kind of explained it in layman's term, which all of us are. We're not doctors. But here, there's other questions that people about for problems that cause blindness. Are there things that you can correct and then things that you can't correct? Dr. Rubin, would you?
So when we talk about eye conditions, there are reversible causes of vision loss. So things like cataracts, very, very common. Everybody gets cataracts, and we treat them with cataract surgery. Loss are things like glaucoma, diabetic retinopathy, age-related macular. We really focus on in the office because your visual prognosis really hinges on prevention. So the sooner we get eyes and the sooner we're able to make a diagnosis, the better we can do to take care of your vision.
A little bit about the difference between an ophthalmologist and an optometrist, because I think some people are getting confused of just getting versus really digging a little bit deeper about these issues that Dr. Rubin is talking about.
An optometrist is a doctor who is primarily concerned with the optics, whether it's glasses, contact lenses. They do have some training in medical diseases of the eye that are medical. However, an ophthalmologist is a physician who's been to medical school as well as additional 4 years at least of training after medical school to diagnose and treat diseases of the eyes as well as the optical portion versus optometry. And our concerns are when we're looking at the aging eye, we want to make sure that we diagnose those conditions that have irreversible causes of vision loss.
That's really.
That was perfect.
So basically,
what do you got?
So I love it. An annual visual, I guess, checkup.
Absolutely.
So speaking of diseases, I don't know if cataract is under a disease category or not, but it's something that people are really just, like you said, everyone gets cataracts. Is that something? Some people are scared to get the surgery. Can you talk a little bit about how that can really improve the quality of life?
Inside the eye, and it's a process that happens in everybody. And when you're born, the lens inside the eye is nice and clear, lets in all the light, so you can see it begins to get cloudy and it starts to block the vision. And it gets to the point where no matter how strong your glasses do the things that you want to do on a daily basis. And that's when we talk about treating outpatient procedure, meaning you come into a surgery center or a hospital, you have the procedure done, and you go home that same day, and most people do it the very next morning. So it's fantastic surgery.
So,
so I think you should take this one, actually. I think you tell it better.
Well, there are a lot of funny things that happen in the office when we are,
That's all right.
when we're examining the patients and what they were used to seeing. There was a situation where a lady came in for her first day post-op visit and was like, when the doctor went in to see her, all she could say was, "What did you do to my face? I never had these wrinkles before." And she hadn't had clear vision in a long time. We have lots of funny stories about stuff like that, but the bottom line is that cases without any other successful, painless, quick procedure with a quick recovery and a very, very high success rate. And we're just thrilled to be able to perform the surgery to restore someone's vision.
Well, and it really does add quality of life. So
Absolutely.
I know as we age, several people get macular degeneration. Is that something that everyone gets, or is that something that just some people?
Great question. So age-related macular degeneration is not something are diagnosed with macular degeneration, and it's one of those things that getting a yearly dilated eye exam, routine eye exam, is going to help us identify and then help us to help you. Can definitely run in families. So if you have a mom, dad, sister, brother who has been affected or has been diagnosed with it, and to get your exam so that we can help you have the best.
It really has something to do with the genes, right? And some things have to do just with aging, just like all our body.
Yeah.
So I have a lighter question. Should I wear eyeglasses? So Dr. Simonian, what do you think about that? Should we be wearing eyeglasses? All the glasses, because we have computer glasses and reading glasses and our general glasses. And just tell us a little bit about that. And is it important to wear sunglasses?
We always want you to have your best corrected vision possible for whatever you're doing during your waking hours. Cataract formation, for one thing, as well as to macular degeneration. Corneas, the front surface of the eye, and cause you a lot of pain. If you've ever had an ultraviolet that block UV light, are critical for outdoor use. As far as, do you need glasses, or do you have 20/20 potential in your eyes, and how are you going to get it? For vision up until that point, start to notice decreasing near vision, you need reading glasses, because the ability to focus up close starts. Glasses all your life, say for being nearsighted, you may find you don't need those glasses to read it. As you need for the tasks you want to do, whether it's up close, computers, or far. And those are different focal points, and that's a matter of optic for that, in glasses and contact lenses.
Yeah, that makes a lot of sense. And
They have bifocal contact lenses
really?
that are disposable.
So that was a lot of questions out here that people are trying to decipher, not only for themselves, that we're really trying to figure out is how to take care of our eyes. Are there exercises? Are there things that we can do to help our... Ruben, you want to take that one?
Yeah, so unfortunately there haven't been any good, especially of sharpening the vision, but we do know that exercise overall is really beneficial for your health. Even walking, doing a little bit of cardio, that's good for the eyes, and to develop glaucoma. So exercise in general, taking a multivitamin, all those are good things for the eyes.
That's good. That's great information. Eyesight. So, Dr. Simonian, what are the causes of vision loss? Just like, what are some of the...
When we're looking at an aging population, certainly cataract, we've covered that pretty well. Even devastating in that it's the number one cause of adult irreversible blindness in the limited to the African American population. But the problem is that glaucoma doesn't affect sun vision problem. glaucoma affects your peripheral vision out here. And it can take away a significant amount of your vision before it may even be noticeable to you. The pressure inside the eye that's too high for what the eye can tolerate. And it's detectable eye exam to determine if damage has been done. We also assess, is it likely that you may have damage associated with to it as well. So certainly if you have a family history of glaucoma, you need to be extra vigilant. Some people, again, genetics play a role in that. And there are ways to slow down progression. It advances anyway. There are treatments that can be given to help. And that pretty much covers the major causes there. Yeah.
Well, thank you so much for the explanation. Very good. I really appreciate that. So one of the things that we, keep talking about in poor eyesight, because we've seen some articles, even the AARP had an article this last time about falling and poor eyesight. A little bit even about light and balance and eyesight and really helping us
to help you navigate your environment. Good lighting is going to be key, giving you the input that you need your body. So without that good visual input, without good vision, you're leaving your know that one of the big causes of falls in the elderly population is just not having good vision. So I think you were talking about some good statistics about that.
Yeah, about 1 in 3 people over the age of 65 are going to suffer some kind of fall that's going to probably take them to the hospital. A good percentage, and other soft tissue trauma or head trauma.
Are you on call, Dr. Sonia?
Sorry about that. The eyes give feedback to the brain, the body, to maintain your balance. If you have decreased vision, those signals get muffled. And then try and do it with one eye closed and see how long you can stand on one foot with one eye closed. And then try and do it with both eyes closed, where you can see how good your balance is when your vision isn't good. That's our concern with then end up affecting their vision and consequently affecting how they navigate. Balance is very important. When you don't have good balance, you tend to fall, and falling on your there are hundreds of thousands of hip fractures in this country every year, and with poor vision, and we don't want that.
Well, that is that, but then if I had one eye closed, I can't imagine how that would be. But I really get the analogy of what that is, because it really does, put you off. I know that we have a couple of questions, but unfortunately, we can't see them. Is put contact information, the website into the comments, and if there's something in particular, then one of the doctors directly. So we really appreciate your time tonight. Is there anything else that you guys...
No, just that we really appreciate the opportunity to be here with you. Thank you so much for arranging and organizing everything. And we are definitely open and available to anybody that needs any help with their eyes through your vision. Please give us a call.
I love that. And Dr. Simone, where are you located?
We are on 12 Mile DeQuinder in Madison Heights. It's 1421 East 12 Mile Road.
Comments, Dr. Simonian, that you want to say?
No, again, we just appreciate the opportunity to be able to spread the word. Are, and even in this environment of COVID, ophthalmology office is good, and we generally are not involved with seeing sick patients, and I would say that's true for all ophthalmologists that do not
Thank Dr. Rubin and Dr. Simonian for taking this time today. This mother-daughter team are incredible. And one of the things that I really love about our loved ones is they take the time. So my mom is a person that she wants to explain some of the issues that she had because she just really felt that something wasn't working right, and just feel so much more comforted, because sometimes you just don't want to feel like a number and you're going out. And I know that these two doctors are so incredible with their patients and with their seniors. So thank you so much for taking your time today. to share with us tonight some of your expertise, and hopefully someday soon.
Okay.
All right, well, I have to go towards the camera here, and